Yes, we are on time. Thank you, Mridu ma'am, for joining us. I will open the stage for our moderators to take this forward. Thank you, ma'am.
Thank you.
Namaste, everyone. A very warm welcome to each one of you. It's wonderful to see such an enthusiastic gathering here today for a conversation that truly matters: women's wellness and preventive health. Now, before we begin, I would like to take a moment to share a little about the initiative that brings us together today. KARM is a transformative institution that empowers young Indian women through skill development, confidence building, and mentoring. It enables to achieve professional goals, financial independence, and equitable growth. Through initiatives like KARM Fellowship, Shakti, Avaz, and mentoring, KARM fosters resilience, leadership, and systematic change so that women not only grow but also create meaningful impact in the world around them. Karm Avaz, in particular, is a powerful movement led by Karm Fellows. It is dedicated to empowering young women, our Sakhis, to find their voice and move confidently toward financial independence. Through engaging sessions like this one, it creates a space where knowledge, skills, confidence, and community come together to inspire real change. And today's session is a beautiful reflection of that vision. Before we start, I would like to share some participant guidelines. So, the first one would be that participants are requested to engage through the live chat and please post your questions on or comments during the session. Number two, in case the YouTube live session faces any technical issue, a Zoom link will be shared with Karm and Karm Avaz community. It will be open on a first come, first serve basis and limited to only 100 participants. Third, the recording and relevant session materials will later be uploaded on the linking channel for wider access. And fourth, all questions shared in the live chat will be compiled and addressed by the facilitator at the end of the session. And now, moving forward, it is my absolute pleasure to introduce our esteemed speaker, Mridu Gupta ma'am, CEO and co-founder of Cancer Awareness Prevention and Early Detection Trust. Since 2014, CAPED India has been working tirelessly in the field of cancer prevention and early detection, with a special focus on cervical cancer. Through community outreach, awareness initiatives, and facilitating access to screening, the organization has been breaking barriers in women's healthcare, especially for those from underserved communities. With a presence across multiple states in India, CAPET is not only creating impact at the grassroots level, but also contributing to policy advocacy and research, making preventive healthcare more accessible and inclusive. Mridu Gupta ma'am's work reminds us that women's wellness is not just about treatment, it is about awareness, agency, and timely action. We are truly honored to have her with us today. Please join me in warmly welcoming Mridu Gupta ma'am.
Thank you so much, Chitra. And thank you to the KARM people. I have deep respect for what you all are doing there at KARM, and I'm so happy to be here and contribute whatever little bit I can to building this space that you all are making. So respectful of what's happening there.
Thank you so much, ma'am. So we would like to start with the questions. And my first question would be, your journey began with a strong purpose. Now, what inspired you to start CAPED India, and why is preventive health for women so urgent today?
So, I lost my mother to lung cancer in 2013. And at that time, I met a couple of other people who had also lost their loved ones to cancer. And we got together and we wanted to do something for cancer. And when we were looking around about what should be done and, what is the space in cancer that we can come to, we were directed towards cervical cancer. So even doctors told us when we were exploring that cervical cancer is something that even oncologists feel really sorry about, because it's a cancer that's completely preventable, and yet we lose so many Indian women to the cancer. And I'm an educated woman. I've been working for most of my life, but I had not heard of cervical cancer in 2014. And I realized it's not really about whether you're educated, whether you're urban, whether you are, whether you are working, whether you're not working. It's just something that we don't talk about in our country. And therefore, women don't know a preventable cancer, and we are still losing women. So, that really hit me. I realized that we are not talking enough about it, and not even the government, not even doctors, nobody tells you about cervical cancer. I have 2 children. I've been to the gynecologist multiple number of times, but nobody said that you should be screened for cervical cancer. So I realized this is something that's missing and we need to start talking. So we got into the space of cervical cancer when we started CAPED. And after that, of course, it's been quite a journey. We realized there were just so many gaps, so many things that needed to be done just to build that knowledge on cervical cancer. And we've come a long way in 12 years. Now, of course, there's a huge buzz about cervical cancer globally and in India. But in 2014, there was nothing. We were just going blind, looking for answers. And the reason why preventive health is so important for women is because, and even at your age, somewhere in our history, women have been taught not to prioritize themselves, right? We prioritize everything. And when I go into the villages also, I tell women ki, if your child sneezes, तुम उसे लेके डॉक्टर के पास जाओगे, चाहे बड़ा हो चाहे छोटा हो कोई, anybody falls sick, the woman will go with that person to the hospital, but अपने लिए कभी नहीं जाती. So even when we ask them, when did you see the doctor, she'll say जब बर्दाश्त नहीं होता तब. So we don't prioritize ourselves, and we miss all of those early symptoms, early stages where treatment is possible. And therefore, it is more important for women to become aware of what needs to be done at what age, how. That's why preventive health for women is very, very important, right? We've got to start choosing ourselves.
Thank you, ma'am, for sharing that perspective. It really highlights how purpose driven initiatives can create lasting impact, especially in areas where awareness is still growing.
Yeah.
Now, it takes me to our second question, that despite growing awareness, many young women still delay prioritizing their health the way you told us. So, what do you think holds them back?
So when you say growing awareness, you have to understand what kind of awareness is that. Yes, there's a lot of information, but that's largely noise. There is no personalized guidance. There is no clarity on it. So there is a lot that's happening, but people are getting that information from just that white noise around, right? You're hearing it on social media, or you're hearing it from... Where is that guidance? Where is the explanation of what it is? You could Google or chat will also give you the knowledge. It will give you the information. But who will give you that understanding? Where will that clarity come from about, okay, is it important? What is my next step? That comes from actually having conversations with the right people, making conversations or discussions around your health priority. That's where it comes from. And that is the gap. You hear about so much. So that one symptom that you may have, or if you go online, there will be so much of conversation about so many things associated to it. You don't know what to pick up and what not, right? So I feel that it's the noise that is coming in the way. Earlier, there was no awareness. Now, a lot of people are talking about a lot of things randomly, so people don't know what really needs to be done. So we are missing that personalized guidance that needs to come in for preventive health to take force. And I mean, that's my opinion. I mean, that's the gap that I see. There could be multiple other reasons for why women don't take action, but that's one of the reasons.
That's a very important point, like especially for young people like us who are still learning to balance so many aspects of life. So it gives us a lot to reflect on personally. I would like to go on our next question. That would be that for a woman in her 20s, what does preventive health practically look like? Where should she begin? And what are a few essential habits or checks she shouldn't ignore?
Okay, so preventive health, what is preventive health? The fact is that it is being proactive, not reactive. If you have a symptom, you will go to the doctor. Of course, everybody will go to the doctor. But preventive health is doing things beforehand. right? Now your body starts to give you little signals well in advance. You cannot say ki I didn't know about it and this has happened to me. Kuch na kuch signal your body is giving you. The point is not to ignore this, right? So when you are completely healthy, you will not prioritize going to the doctor or doing any check, right? Preventive health therefore takes a back step. Okay, I'm perfectly okay. There's nothing wrong with it. It doesn't strike you that I should be doing something while I'm healthy. No, of course, nutrition you all do, whatever, diets and things. You go to the gym, you would do all of that because dikhta hai, right? My skin looks better. I'm losing weight, or I'm getting my bikini bod, or whatever it is. That all of those things you can see. So you make that effort. Health you cannot see till you get a symptom. So preventive health, largely at your age, it's definitely being aware of your cycles. You must have an aware, understand your body, understand what your body wants, right? It's not that every month you cannot go into just saying that, I feel bloated, or I have hormonal change, or I have something. Understand it. It makes you more capable of handling things. It makes you more capable of handling your body, of understanding naming what's happening to you. That reduces stress. And stress is a huge issue for all of your PCOS and all of these other things. Managing stress, having good relationships, sleep. You cannot underestimate the power of good sleep and good nutrition in the 20s. Have baseline checkups. Do you know what baseline checkups are? Just a regular blood test. Go to a gynae once a year. Just baseline checkups, practice safe sex, manage your stress levels, eat, sleep well, monitor your cycles, know what's happening with your body. If there's any change at any point, you should be able to recognize it. These days, because I work in cancer, more and more young people are getting cancer. Very young. Recently in the village that we were working, a 24-year-old girl, of course, they get married early, they have children early, but she's 24 years old. And we caught her with breast cancer early stage because we were screening. So these things they're happening earlier, but your body will tell you. So stay on top of it. Make sure that you're doing, even if you're in your 20s, make sure you have your regular checkups, see a doctor, manage your stress, manage relationships. All of that, mind and body needs to be healthy all the time.
I think that's incredibly helpful, especially because preventive health can often feel abstract until it's broken down into simple and actionable steps.
Absolutely.
And this takes me to our next question, that we often normalize symptoms like irregular periods, fatigue, or hormonal issues like PCOS. So when should women stop dismissing these signs and seek medical advice?
So one point in this is that we usually ask friends and family and things like this, right? So if you have something that you are suspecting in your cycle, let's say your cycle is becoming heavier, and you ask your sister, your sister-in-law, your mother, they might normally have heavy cycles and they'll say, हाँ ये तो normal है, मुझे तो हमेशा होता है. So that's why I said earlier, understanding yourself. If something is abnormal to your normal cycle, it is your abnormal. It does not have to be abnormal in some medical terms. It's your abnormal. Get it checked, right? So any symptom that lasts for 2-3 weeks and is not getting better, or 2-3 cycles and is not getting better, you need to see a doctor. Doesn't matter if the doctor tells you that's such a silly question that you've come, kuch nahi ho raha, sab theek hai. Sun lo. Usually that happens. We are very afraid to go and see a doctor because we feel that they are going to say you're being so stupid that you've come with this. Jao. Let's normalize this, right? You go and you show all of them. For cancer, like we say, at a later stage, maybe, but for everybody to know, if any of the symptoms last for 6 weeks or more, you must see a doctor, right? And in women, if it is for 2 or 3 cycles, so you're having the same problem that's coming in, don't let it go beyond that. Yes, one time could be an off chance. You may be having a bad time, could be a bad stomach, could be an infection. Okay. But if it is something that's for 2 or 3, if it's cyclical, you must see a doctor. That's a flat thumb rule. Don't let it go beyond that.
Right. That really helps in understanding the fine line between what we tend to ignore and what actually deserves our attention.
Yeah.
And it's something many of us can relate to, because even I suffer from PCOS, and I know that how difficult it gets and why early screening is so important.
Yes, absolutely.
Yeah. So my next question would be that there is still hesitation around reproductive and sexual health conversations, including topics like HPV and vaccination. So, what should young women know to make informed decisions?
Okay, for one thing, it is normalize this conversation, right? In our country, anything to do with sexual health takes very long to become common practice. Even for AIDS and all, we came into the preventive space much later than the rest of the world, when everything had been done, had been planned, because we are not comfortable talking about it. So those conversations, it's for you youngsters to make. For my age people, we are not going to try and normalize that conversation. For us, the days are over. हम कितने लोगों को बताएंगे? But you all should normalize these conversations. Make it normal to ask conversations, but seek credible sources. If it is a trend, while not all, but most trends have something to gain. Somebody has something to gain. So question trends. Go for credible sources. Look for who is making sense or who has the credibility to speak about something, right? And then treat your sexual health like any other aspect of your health, right? If your family has diabetes or has blood pressure issues, you're going to be worried about it. You're going to look at it much earlier in life. You will start getting yourself checked earlier in life. Same with sexual health. Just make it a normal part of your life that needs to be looked at, needs to be checked, needs to be kept in check. Go for your regular checkups, talk about it. That's the only way you will become more confident. And to make informed decisions, you need the right information. So credible sources, question trends, and always speak to somebody who knows what they're talking about, right? And then make a decision. So that's very important. HPV, I don't know why people question HPV, because globally the vaccine is being given to girls, and in some places girls and boys, in over 170 countries now. So even if you were to look for it, there has never been any question about it. It is one cancer that can be prevented, and it has a simple prevention, right? You do the vaccination. You get screened twice. In India, we carry the largest burden of cervical cancer deaths, right? We say we lose one woman every 8 minutes. You have a 1 hour podcast. We would have lost 8 women somewhere in the country, right? It is that damaging. And all it requires is one vaccination at a younger age and 2 screenings in your lifetime, and you're completely safe. Why is there a question to it? Why do women sit around and question it? Don't we want to be safe, and don't we want the women in our country to be safe? So that's my contribution to the HPV bit.
Well, while we have heard, HPV is something that many of us have heard, but don't fully understand. So, could you please briefly explain that why is it important for young women to be aware about it and just shed a little bit light upon it and what it is so that we can understand?
Okay. Now, HPV is the human papilloma virus. It's a viral infection, and almost 80% of all sexually active people will get this virus in your lifetime. So it's not like it is a risk factor, like we say, okay, these people are whatever, you're overweight, or you are, this is your dietary, or this is your geography, so you might get this disease. No, it is something that can happen to you anytime in your life cycle, right? Across life. So to take prevention about something that can happen anytime in your life, it's best to take it early, right? We give all our vaccines to children early, right? Chickenpox ka vaccine ho, tumhara polio ka hai, everything is given in the younger ages because your body creates antibodies better. So HPV is an infection that all sexually active people can get. And usually, if you are strong and you're healthy and you have good immunity, your body washes off the infection like any other viral infection. And the body will clean it out. But sometimes women, or when your immunity comes down or you're not able to wash off the infection and you're exposed to it over a long period of time, in 1 to 10 years, that infection eventually turns to cancer. So all HPV infections are not cervical cancer. All HPV infections will not become cervical cancer. But if you are over the age of 30 and you have the infection, it's believed that your immunity is coming down. So it's better to keep an eye on that infection and remove it before it becomes cancer, right? But if you take the vaccine at an early age, then you will not get HPV infection at all, right? So the countries that have had it very recently, I think in Jan or in Feb, there was a paper that was published from Finland or Netherlands. They have been giving this vaccine now for the last 12 years or 17 years. So it's a long-term vaccine paper that shows that almost 99% of those girls have not shown an infection in their life, right? The antibodies are in the body. So of course the girls get it at 14, but every time they check, that antibody exists in the body. And none of those girls today, 17 years later, have an HPV infection, which is a very large number, right? So that's what HPV is. That's what it does. And that's why we need to prevent it. It's just a vaccine that prevents you from even getting the infection. And the infection may or may not become cancer, but the chances are there that it will eventually. The best to be safe.
Thank you for addressing that so openly. Like conversations like these are essential in breaking stigma and helping people make informed and confident choices. But
Absolutely.
now, what I would like to ask is, with so much information and misinformation around us, what does truly taking ownership of one's health mean, and what is one simple step to start with?
Okay. Ownership of your health is like what you said earlier, right? You have to make informed choices, listen to your body, and act early. Be preventive rather than reactive. I had said that, right? So you start early. So it is being proactive about your body. That is taking ownership of your body, right? What was the other question? One was how do we take ownership of our body? And
There is so much information and misinformation around us. So what could be that one small step to, so that we can actually take ownership of our body and
correct.
Do the correct.
Okay. So if we say ownership of the body is that you have to make informed choices, start acting early. So one thing would definitely be to have a basic health check, right? So you take your blood test, check your vitamin D, check your other vitamins, check your blood count, see that everything is okay. Regular, no infection in your body, just a regular checkup, and start tracking your cycle. For everybody, start tracking your cycle, start tracking how the body reacts, when it reacts, what it does, whether it's bloating, whether it's some kind of a change, swelling, pain, whatever is happening, understand your body. Understand it, figure out that this is going to happen to me every time, be accepting of it. It just makes the emotional management so much easier over life. It reduces the stress and anxiety that the mind and body has with the cycles, because it happens to us every month for years and years and years, right? So it's best to know yourself, and then you understand that trend. So the next time something happens, you know what's happening to you, you know how it's going to go. So one very, very important thing is to start tracking your cycle, right? That awareness will create that first shift in how you manage yourself, your timetable, your life. Choose yourself. So build that into what you're doing. I think that would be a very easy way to start, right? Either get a health check done. In fact, if you ask me, get both done. Get a health check done and start tracking your cycles. These days, I think there's an app also that helps you track your cycles. It tells you what to do or something. I think there are multiple things like that coming up. I was on a panel once where somebody said that they'd made this app. So I don't know what the name is, but I know that somebody was talking about it.
That's a powerful way to look at it, and bringing back the focus to awareness, responsibility, and small but meaningful actions we can take in our everyday lives. Now, it takes me to the thing that you said earlier in the very starting, that when you started, like you have been working in this field for so many years, and in the starting, when you started, so what were those gaps that you saw in this particular thing, and can you please elaborate on that part?
So gaps, there were a lot of gaps. For one, nobody wants to talk about cancer. So cancer itself is a gap, right? Because हमारे में ना they say कि कोई बुरी बात मत करो, हो जाएगी. बुरा सुनना नहीं है, बुरा बोलना, because वो चीज हो जाएगी. So there is this hesitation in talking about about cancer itself. And then this is women's cancers, right? Women don't want to know. There is actually a safety in not knowing. Because even when we do screening and we tell people that your screening is positive, you have to see a doctor who will then confirm whether this is something that's happening to you or it's just a false positive. So even after that screening, women don't go further to the doctors for checkup. She doesn't want to know कि मुझे कुछ हुआ है कि नहीं हुआ है, right? So that fear, that stigma that goes with cancer, that was one of the biggest hurdles, even in urban India, even in rural India. So everyone used to tell us, don't say you've come for cancer awareness or cancer screening. Just say you've come for women's health, then women will come. And I used to tell them that this is false. No, you call them for women checkup and then you do a cancer checkup and they are not expecting it. So we go into villages saying कि हम cancer के रोकथाम के लिए आए हैं. You can prevent cancer if you come and get yourself checked. और हम पूरी awareness और mobilization करते हैं. And women have started to come. We screen about 100, 120 women at every camp, wherever we go, which means that people want to do something for their health, but they're just scared because no one talks about it, which is why I'm telling you, start conversations. Talk about it. It's the only way you can overcome stigmas and fear. Studies show that the only way that one can overcome fear is to open it up and talk about it. So cancer on its own is a fear. And women's cancer, women's body, and talking about our body, talking about our problems, talking about cancer was a big hurdle for us, huge gap, which is why we decided awareness is the most important thing. And now I'm telling you that y'all can do that. Just normalize conversations about sexual health, about women's health, about prevention. That overcomes a lot of these gaps. And then, of course, was the fact that there is no availability of screening for women. Where will they go to be screened? There were lots of those gaps also, which was no screening availability, no privacy for them. They don't want to have a breast or cervical screening in a lab that has other things happening. So all of those were gaps that we addressed over the years. And some still exist, but yeah, we're working on it.
Yeah, thank you so much, ma'am. I just want to focus on HPV vaccine. I see that women have a lot of fear, and they also have like myths about the vaccine, that it has side effects or they should not take it, या फिर उसका कुछ अलग ही असर हो जाएगा. So, ma'am, how can that be addressed? How can women can get short कि नहीं? I mean, this is for them only, for their health only.
So the first question again to ask is, where have those myths come? They've probably been hearing or reading something that was random, right? If you go to the studies, there is enough and more studies that tell you that it is safe, that it does not, we hear so much that it will affect infertility. Why are you vaccinating only the girls? So if you look at it, cervical cancer is the largest burden of HPV. And cervical cancer happens in women. Of course, HPV causes 6 different types of cancers, even in men. But we screen women, we know that that HPV causes cervical cancer almost 99% of the times. Cervical cancer is caused by HPV. So we are saying, let's protect the women first. Let's eliminate cervical cancer. When we vaccinate boys and girls, then we will be looking at eradicating or eliminating HPV. But abhi we are saying, let's eliminate cervical cancer. Let's vaccinate at least the girls. That's a huge burden. And the best age to vaccinate is when they are younger, when the body creates antibodies best. All vaccinations are given. But the vaccine can still be given till the age of 26 comfortably. Over the age of 26, you can speak to your doctor and get vaccinated. All the countries that have done the vaccination, ever since 2006, when it was made available, it's not a new vaccine. It's been around for 20 years. And all the countries that have been doing this vaccination, there are studies from there. So look at the science. There is enough and more studies that tell you that it is completely safe, not a single side effect, no cases. The women have gone ahead and living a happy life, no HPV infection. They've had children, they have families. All of that has happened. In India itself, there was a study in 2009. Those girls today are married, they have children, they are happy. So nothing... these are all myths, and the only way to overcome them is to present the science behind it, right? So we have, if you go on the CAPED page also, even if you just Google, go to WHO, go to any of them, there are enough and more studies that tell you that the vaccine is safe. What was the outcome of the vaccine? How many countries have done it? What's happening in those countries now? What is their cervical cancer rate in those countries? All of that will prove to you that the vaccine is safe. There is no other way to counter doubt and opinion. Only science works. So we have to be able to simplify that science and make sure that all the women understand that, right? Otherwise, I don't know why it happens, but if there is negative news, no, it travels so fast. Everybody will have that within any time. और जो सही खबर है उसको हम डालते रहो, बोलते रहो, वो कहीं जाती ही नहीं है. So the only thing we can do is just continuously keep countering all of these myths with the fact that there has never been any side effect. And if you hear that, oh, there's been a side effect, you need to find out what was the science behind it. There must have been some other cause for it, right?
So true, ma'am, that bad news travels faster than anything. And even my friends also, they had like this myth that it will impact on their fertility or their body. So I just wanted to ask that.
Yeah.
Also,
I am happy to send you some studies and some documents that will tell you this. That is, and there are videos and also of people who were even in India. So I can share those with you of those of women or girls who were vaccinated earlier, married, they have children now, no such thing. So I don't know why these things are circulating. And, as it is for women, anything coming out for women takes so long to come out. We've been fighting for this vaccine since 2017. Up जाकर के from 2022 they said आएगा नहीं आएगा. We know it saves lives, but still everybody sits around and talks कि दे क्या, कब दे, कैसे दे, अब नहीं देते, चलो एक साल बाद देंगे. वो होते 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 अब जाकर के that vaccine has actually come. And then we have so many people who come in and say ki mat lo, mat lo. So, and they say there's no cervical cancer in India. Actually, cervical cancer is the highest in India. We carry the largest global burden of cervical cancer alone, one country. One woman every 8 minutes is a large number, right? Isn't a woman's life equally important? Shouldn't we be saving her life also? So please tell your friends that, and I will send you, if I can, all the videos and the documents we
yes,
have
ma'am.
that say that it's safe.
Yes, ma'am, please. Also, it's just the only way to inform ourselves is to read. That we often ignore.
And read
yes,
the right kind of literature. Read from the right credible sources. Absolutely.
So true. So, ma'am, recently I also noticed that government also launched this nationwide HPV vaccine. So, ma'am, could you please put some light on that?
Yes. So the vaccine by the science between 9 to 14-year-old girls should take the vaccine. Now, earlier it used to be 2 doses, 9 to 14, and 3 doses over the age of 14. But now the study says that 1 dose is also good enough. And the government has launched a single dose vaccine for 14-year-old girls, right? So 9 to 14 is the ideal age. 14-year-old girls, all 14-year-old girls can go to the nearest health center and get the vaccine. It is free of cost. That is for the next 3 months that it's going to be available. After that, it will be available at facilities where they have a cold storage where vaccination can be done. All 14-year-old girls can go and be vaccinated. The government says that later on, after about a year or 2 of this, then it will come into the UIP. So just like you take your BCG and you take your tetanus and your polio, you will get the HPV vaccine. But till then, till the time it comes into the UIP, it is your job to go and be vaccinated. So everybody, you need to go and get vaccinated. You have to, it needs parental consent for girls till the age of 14. Over the age of 14, if you are till the age of 26, please see your doctor. You can be vaccinated anywhere. In India, the vaccine is allowed till the age of 45. So that speak to your gynecologist if you are over the age of 26, but at least till the age of 18, till the age of 26, get your vaccine, right? So the government has launched it. It's free of cost. Make sure that everybody who's around the age of 14 goes and gets the vaccine.
Yes, ma'am, I was also reading about that. Thank you. Yeah, Chitra, you can take forward the stage.
All right, so I wanted to ask a few personal questions that you have worked on ground. So, in your experience of working on ground, what are some of the most common myths or misconceptions women have about their health that still persist today?
Oh, so one of the, I don't know whether it is a myth or it is probably a misconception, but I don't know why it is that women feel that pain is something that we should bear. We shouldn't complain about pain, right? Because of course we've given birth and all also, even the older women, right? So if we can take that pain, we can take any pain. So we ignore pain. Pain is a very big factor in telling you that something is wrong, right? One of the earlier camps we had, we went into the village and this woman says that she's been having a pain in her pelvic area for a very long time. And she was saying, oh, meri bahu is so nice. वो ना पानी गर्म वो hot water bottle करके मुझे देती है and I get so much aram. All these years, she's just been praising that my daughter-in-law is so good, which is a good thing that you praise your daughter-in-law. But that's what you've been doing. She is heating the water bottle and you are using that water bottle and you feel that I'm getting aram. She can't move. She's been keeping it here, there and all. And then she had a checkup and sure enough, she was in an advanced stage. That the pain comes much later in cervical cancer. Early stage is nothing. You don't even know that there is anything. There are no symptoms, nothing. So we dismiss pain as if we should be very strong and we should be able to bear pain. That is a huge misconception. You are human just like anybody else, right? Your threshold, every person's threshold of pain is different. So if you are experiencing pain, then there is something wrong with you. You need to go and see a doctor. Most doctors also over the years have dissed women's pain, which is why endometriosis and all did not get the attention it needed, because everybody said, oh, it's just pain. You are exaggerating the pain. But if you have pain, go and show a doctor. That's one of the factors that I get very upset with people when I go, because they just don't do anything. They feel that pain is not a symptom. It's just pain. I can handle it. That I am a superwoman. That is a huge fault that we have. Another one is this fear of talking about your health. They feel that if I talk about my problems or if I talk about my health, I become weaker, right? So they don't. Normally, when I speak in a hall, when I finish my awareness, I always tell them that I'm going to be sitting here for another half an hour, 45 minutes. And if anyone has to speak to me personally, you can come and ask me. And then slowly, one by one, they will come. And sometimes there will be women who wait कि सब चले जाएं, जब खाली हो जाएगा, then I will go and talk about my problems. So I understand privacy, of course, that is important. But this fear of to talk about yourself or to talk about your health or not knowing what to say is it is a challenge, because we believe that we should not complain. है ना कि हमें we shouldn't be doing all of this. That has led to a lot of gaps in women's health, because we don't speak up. We need to speak up about our body, about things, get over this shame, all of this. ये जो शर्म है, ये जो डर है, we need to get out of that. That for women is, I feel that's another, I don't know what do you want to call it, a misconception or a myth or something, but yeah, we need to overcome these. And I find them everywhere across the country.
I totally agree. Like, we see that in our homes around us on a daily basis, women ignoring their own health and the symptoms that could be actually cured in the early stage.
Yeah, absolutely. Yes. That's the whole thing. Most treatments, if they start early, that's the game. And we work in public health. Public health means that you should not need hospitals, right? That we should be able to prevent things. We should be able to do what needs to be done so you don't get to a hospital. So early detection of any disease is the only way to go. We need to figure out how to catch it early. And women they're not helping themselves by doing this, by delaying it, by dismissing it. And why do I say it happens to me also? Dant mein dard tha for so long, I kept trying to eat from the other side and whatever. And then finally my son fired me. He says, you go around telling everybody early detection, why don't you go see a dentist? So I said, that's right. Why am I not going to a dentist? And I finally went to her and she says, very bad state the tooth is in. So I was also, adapting, eating from the other side, trying to avoid this, not eating thanda. Khud bhi karte hain without realizing it that we do it. So yeah, it's for everybody. So women need to do that. We need to become proactive about this.
That's right. While it's also that women have been conditioned to ignore their own
Yeah.
health, but many barriers to women's health are not just personal but also structural. Like, I feel that access, affordability, or stigma, they also play a very important role in that. So, what changes do you think are most urgently needed at a societal or policy level?
So that's what I was telling you earlier, right? That when we started, that of course awareness was a big deal, but also she had no place to go for screening, right? There was no access. It wasn't made easy for her. So that's what we see. Usually men have the health facilities also are more geared to support men than to support women. It's not made for her. She won't have a washroom if she goes someplace. She'll avoid going. It's her, she won't have privacy when she goes to these two places like this. And that's something all of us see. If you go for a road trip in India over a long period, you will not find a decent washroom for women, right? We have to stop and search for some place that we can go to the washroom. So these look like very simple things, but they make a huge difference to access and to for people to avail of things. In schools, we find government schools, if they don't have good washrooms, girls drop out. Girls, all of them, the dropout that comes at that age when they start their cycle and when they start periods is because no access to flowing water, no washrooms. A lot of that becomes a challenge. So definitely having women-centric policies in health are very important. You cannot have just one rule and expect that to work, whether it's for men or for women. So in Delhi, of course, if you remember, we had these pink clinics that were women clinics only, where women could come and be screened. We need to do that across the country. We need to be able for women to have access, to have privacy, to feel safe about going somewhere and being tested. And I think for society, we need to open it up. We need to make her accessing healthcare normalize that, not make it sound like a big deal, not like she has to give up her work and she has to make the time to go, and then she has to take favors from people to look after her kids or do whatever. It should be normalized for her to go and avail of health facilities, and the health facilities need to be aligned. So on our side, when we work for cervical cancer, now for other women's cancer like breast and oral, we are working, of course, with communities to give them awareness, to bring them, but we're also working with the health system to create that change in delivery. How does it delivered to her? So for her to get privacy in the health, even at the uh, the lowest facility level, right? The primary health center, the sub centers, right till there, for it to be geared for women, for it to be women friendly. That's very important. Of course, there are lots of huge other issues also, like clinical trials are not done for women. Most of the trials that are done on men. So the medicines we take, the dosage that is suggested has been tested on men, not tested on women. So there are, of course, those very deep issues that need to be seen at a higher level about how women can be represented, whether it is in clinical trials, whether in other places. Women representation is very important at the policy table, all of that. So that's something that we should be looking at. And for all of you at KARM, you all need to open a public health line as well. You all should be working in public health also for women. Just like you all have law and the others, you should have public health.
I think that will be there soon enough.
I'm sure the way you all are growing, I'm sure that's going to come soon enough.
Sure. Okay, so while we were talking about that how the policy could be there, and at the same time, should cervical cancer screening be integrated into workplace health programs, and would that significantly improve early detection rates?
So definitely, I think the corporate plans that are there, whatever health insurance plans that you have, these executive plans for them, they do have HPV testing, or they have a PAP or something. I've seen a number of them that have it. But the fact is that women don't know what to do with it. So even if that comes if you get your report with all of those tests and your pap test is positive, or it's I don't know if they're doing HPV, but they're definitely doing pap. If it comes positive, what to do next? So we once did an awareness at a corporate office. That is a huge corporate office that has offices across the country. And the HR there said, she said, after we finished the talk, she came to me and she said that in our health insurance plan, I had seen HPV, but I didn't know what it means, so I didn't choose it. So she didn't choose it out of the tests that she had to choose because she didn't know what HPV meant, that HPV DNA test. So like you have an HPV vaccine, you have an HPV DNA test. That screening is supposed to be done for all women over the age of 30. You need to take an HPV DNA screening once every 5 years. So while the vaccine will prevent in the future, the screening protects today. All women who are over the age of 30 need to be screened today so that if you have anything, the body, it will be checked. So if you can bring it into your office after the age of 30, if all women are being screened, of course, that will prevent cervical cancer. That's a huge workforce we are talking about. So definitely. And create awareness. Like she said, I didn't know what HPV is, I didn't choose it. Similarly, women won't know what that test is. Create awareness so they can go home and tell the other women in their house also to go and get that test done. Right? So awareness, and yes, definitely bringing it into the corporate workplace, very important.
All right, we have one question from the chat, and I would like to ask you that. Are men being left out of the conversations on HPV and cervical cancer prevention? And does that limit how effective prevention efforts can be?
So men are being left out. When we say that girls are being vaccinated, yes, we need to bring men into the conversation. In fact, CAPED runs a program. Currently, if you look, we have a campaign that's Men to End Cervical Cancer. Right? So we bring the men in, we talk about how men can be a part of it, but also HPV affects men as well. So them being aware and them knowing that they can go and be vaccinated at the pediatrician is a very important factor. Yes, if we bring men and women under the vaccination in the awareness, we will eventually eliminate. We can't, but that infection will go away, right? We're looking at managing HPV then. Currently, for cervical cancer, girls being vaccinated is very, very effective because it protects the woman from getting the infection. So we are protecting the woman anyway with that vaccine. But bringing men into the conversation in India, especially, which is a very patriarchal society. So for men to be aware that, yes, their daughters or their wives or the women in their house need to be vaccinated or should go and be screened is important. So in India, bringing men into the conversation has multiple levels. They should be aware and get vaccination. They should be able to support the women in their family, in their community. At multiple levels, men part of the conversation is very, very important. And I was at the World Cancer Congress and other global platforms. There are organizations around the world that is for men for HPV elimination, right? So they are like No Man is an Island. That's an organization that works only for HPV and men. That men should be vaccinated. The HPV vaccination should be globally released for men. So it's a very big factor, and it will make a huge impact over a long period of time. But yes, in our case, even our field teams that go into villages and talk about women's cancer like cervical and breast, even they have men in them. So we say men to end cervical. Those men will go speak to the village pradhans. They speak to the village men, and they explain to them about women's cancer. So men are a huge part of for cervical cancer outcomes in India at multiple levels.
Definitely, that's true. I think during an intervention, including everyone in it is very important because, of
Correct.
course, men also hold that power in the family.
Absolutely.
I'll ask that one last question that CAPED has worked extensively at the grassroots level. So could you tell us how your community outreach model actually functions on the ground?
So we have always believed that awareness and conversations are very important, right? when we came into this field, we had seen other models where people go in and they screen and they say, we've come to screen, and they collect the women and try and screen. But we decided we would not do that. So every time that we go into any village, we first take the time to get to know people. So we meet the Asha workers and we get to know the village Asha workers, even talk to her about cancer. Sometimes we even do a training for the Asha workers and the doctors and everybody first. Then with her, we go to the village pradhan, sit at the panchayat, speak to the men, speak to everybody. Then we do a whole mobilization in the village, which means that we go door to door. We talk to people, we give them flyers, we have them, we talk, we explain to them, we take questions, we answer. So we address that fear, that stigma that comes with cancer and with women's health. First, we address that. So for every screening camp we have in a village, it takes us 2 days to do only this mobilization and community awareness. Then we tell them, the van will come here on so-and-so day. You can come and be screened. The doctor will come to screen you. So we believe you have to build this trust with people. First, you have to make them understand this. Otherwise, that fear, it will become a fear. Of course, it's a new thing. And you just one day a van comes, you go get tested and it comes positive. डर क्यों नहीं लगेगा? सबको डर लगेगा. But पहले explain कर लो that it's nothing. It's a screening. It could be, may not be. And even if it is, it will just help you prevent it. You catch it early and we'll prevent it. If we've caught it late, we'll help you treat it. मतलब जानो तो सही कि क्या हो रहा है तुम्हारे साथ. So we take that time, our team spends time in the village. So when our van comes, there's no fear. Everybody recognizes us, they recognize the van, they know it. So for us, that actually, I think, is the mantra that has helped us reach 72,000 screenings in the last few years. And all of that has happened. We've been to about 1,300 villages in these last some years. All of that has come because we take this time to build trust and to build a community bond with them, and then get into the screening and the take action.
Thank you, ma'am. Actually, we have one question in the chat, and that is, we fear of getting screened. That what if we get detected something, and then all the follow-ups, it will cost money, of course, and hence we tend to ignore. So how can we address this fear?
Yes, this out-of-pocket cost, the financial burden, financial toxicity, they say, of cancer is quite large. But you have to take an insurance, and these days there is cancer insurance as well. If you go to any government hospital, treatment is free. India is one of the few countries where entire health in any government hospital is free for everybody. Yes, there is a challenge that you don't get the right quality, you will not get all of them, but some of the best hospitals are government hospitals, like the AIMS and all. They're all government hospitals. There is a struggle to get in because of our sheer population. That is true. If you have the Ayushman card, you can go to any private hospital that is empaneled in it. Otherwise, taking an insurance and being regularly screened from the right age is actually reducing your cost, right? If you were at a later stage and you were going to be screened and you were going to be found with late stage cancer, then of course it's a huge cost. So in any case, prevention is more cost effective than delaying it. So do it now, find out if you have something. It's an out of patient, it's an OPD treatment if they do find something at an early stage. You don't even have to be admitted in the hospital. OPD treatment, they'll clear out the infection and clear out the early symptoms, and you're free. But if you don't do it, if it's a positive now and you don't go fearing that, it will be a cost or whatever, it will become late stage. And late stage is a huge cost because it's a complete cancer treatment cost. So whatever it is, it's better now than then. And otherwise also, if everything is okay and you don't have an insurance, take the insurance or get your Ayushman card or be prepared, always. Be prepared for something. The fear and the don't want to talk about me, if you are unprepared, that's a worse state to be. It's always better to be early, be prepared, and then deal with it. Does that help? Though, of
Yes,
course,
it
financial
definitely helps. I mean,
financial toxicity is a big deal because you can't take it lightly because it is a big question for people.
yeah, definitely, because whenever you go to some, like, you go to a doctor. Like recently, my mother had some issue with her eye, and when we went and the screening and everything, a bill of 5,000 in the very starting came up, and we were like, okay, that's a lot. But at the same time, it's safe to be,
Yeah.
you know, uh, do it early so that later on nothing big comes up.
That's true. But also, almost 70% of India is uninsured, which is a huge burden, right? People should look at that. You need to take health insurance, even if it is to be able to, deal with things like this. So, insurance in other parts of the world, in the developed countries, insurance is a must. Everybody has insurance, right? Health insurance. In India, we don't take health insurance. So, that is important. Otherwise, yes, one really feels the burden of health treatments because you never know what's going to come up when, so that is true.
Thank you so much, ma'am. So, as we come to the end of this insightful session, I would like to express our sincere gratitude to you uh, for today's session. So, ma'am, the today's session on women's wellness and preventive health, it has highlighted a powerful reality that women often prioritize their families over themselves, especially in villages, making preventive health all the more important. You clearly explained that while information is available, true understanding is still missing, and that preventive health is about being proactive and not reactive. Your emphasis on understanding our bodies, tracking our cycles, managing stress, and ensuring good sleep, nutrition, and relationships was extremely valuable. You also reminded us not to ignore pain and to seek medical help without hesitation. And one of the most important takeaways was the need to normalize conversations around sexual health and rely on credible sources. And the statistics about cervical cancer and your emphasis on the HPV vaccine truly underscored the importance of early prevention. You also shed light on broader issues like lack of awareness, inadequate facilities, and the need for women centric policies while reminding us that men must also be part of this conversation. So, on behalf of everyone present, I sincerely thank you, ma'am, for such an enlightening and impactful session. I would also like to thank the organizers and also the participants for making this session a successful. Thank you so much, ma'am.
Thank you. Thank you. It was a very enjoyable session. And from your synopsis, it feels like I spoke about too many things. There were just so many points in there. ऐसा लगता है बहुत ज़्यादा बोल दिया. But even if some of that registers, I am happy. But it was a very interesting session. Thank you so much. Thank you.
Thank you, ma'am.
Although Chitra has covered everything, I'm so sorry if I cut you between. But I would also like to extend my heartfelt gratitude from the KARM team for taking up this crucial topic and breaking it down into simpler and more comprehensive way. Thank you so much for that.
Thank you. Thank you, Jyoti. So happy to be here, and I'm so glad that it was something that you all could relate with. So thank you.